Hello students. Last time we had seen the topic rape. It is not yet completed. We will continue with the same, but I will just revise in short what we have seen in the topic rape. So first is its definition. A definition according to Indian Penal Code 375. We have seen all the details and how the definition itself explains the medico legal aspect of rape. Then we have seen that medico legal aspect, why it is called as unlawful when it is done. Again, there is one important condition for unlawful is age factor. Second is sexual intercourse. Slightest penetration is also enough with or even without emission of the semen for the blame of rape. By a man, no age limit. For a woman, no age limit. Against her will, that is very important. Then examination of a rape victim, it can be asked as a separate 10-mark question. It is asked as a separate 10-mark question, that is examination of a rape victim in the question number 4. So there has to be consent in writing. If the girl is less than 12 years of age, it should be taken from her parents. Then it should be taken in front of witnesses, and the report should be signed by the witnesses as well. If the doctor is male, the examination should be done in presence of a lady attendant, either nurse or a relative of the victim. Then preliminary data, we have seen all these details, how the statement is to be recorded, how the statement is to be taken from a victim. Then signs of struggle, we have seen all the details. Examine the clothes and body carefully for injuries or some signs of struggle. Tears of the fabric, if there is mud, grass, stains of blood or stains of semen are present there, then you should go for blood stains for grouping whether the blood is from victim itself or from the assailant. Then we have seen one more important point, that is Locard's principle of exchange, that is asked as a 2-mark question. Whenever two objects or two persons meet, either for quarrel, for any struggle, or for for the purpose of rape. So when the two persons meet, there is the exchange of certain material between them. So there will, the nails will show the tags of epithelium while scratching or while resisting. The tags of epithelium of the opponent person will be seen, and they have been caught in the nails. Then whole body should be examined for the mark of violence. There can be the exchange of so many materials like ornaments, tears of the fabrics, and all, so many things will be found. Then also hair, so many things. Then very important is examination of the genital organs. It should be done very carefully and in good light. It should be done in lithotomy position. See for local signs of violence, whether there are injuries on the genitalia or on the vagina, that should be seen carefully. Blood stains on the legs or on the vagina. Then pubic hair, whether the foreign hair are present there, where the pubic hair are clogged or matted with blood or semen. Then examine for the spermatozoa and other microorganisms. One term we have used there, that is smegma. Smegma are present. Smegma is a cheesy white bad odor material that is collected on the glands, that is covered with the prepuce. When the prepuce is retracted, when the skin or the glands is retracted, a thin layer of this white cheesy material is present on the glands. If the person has recently done the sexual intercourse, it will have been washed off. So that is again important sign. Then venereal disease, we have seen all the details of gonorrhea, syphilis, chancroid, how you should go for that incubation period. Then injuries to the vulva, hymen, vagina and perineum, that is again important. Recent rupture of the hymen will be manifested by ragged tears of on the perineum, on the periphery, or with edema and hemorrhage. Because of genital injury, she will not be able to walk properly. That's why she will be walking with legs apart, and the gait will be very painful. Now very important another examination, that is examination of the accused. So we have seen all the details of examination of victim. Now today we will start with examination of accused in case of rape. So how will you examine a suspected person? So again, examination of the accused, you should go for preliminary data. All the preliminary information should be collected from the assailant or that suspected person. So his name in full, age, occupation, address, who brought that person to the hospital for examination, either police or whatever, whoever the attending person is. The name of that person should also be recorded. Then identification mark, whether there is any identification mark on the body, either any congenital mark like mole or any scar of the old injury, like that, any identification mark on the body. Then consent should also be taken from that person, and time of examination, when you are performing the time, day, date, everything. Physical examination and mental condition should also be seen, because in case of rape, that person can be mentally ill, he can have some psychiatric disease, so that should also be assessed very carefully. So physical examination should be done again for Locard's principle of exchange, that is any sign of struggle on cloth and body, or any injuries or any scratchings mainly on the face and on the chest, they should be examined very carefully. So physical and mental condition should be seen carefully with signs of struggle on clothes and on the body. Then careful local examination of the genitalia. Now according to section 53(1) of criminal penal code, 1973, accused can be examined or suspected can be examined even without his consent. If the police has brought that person to the hospital for medical examination, even that person is not willing to undergo examination, according to section 53 subsection 1 of criminal penal code 1973, the person can be examined even without his consent. What we have mentioned here, the consent, just in the above point, the consent of the accused should also be taken. But in cases if that person has been brought with the police, by applying the section 53 subsection 1, the accused can be examined even without his consent. If the person has been arrested immediately after the incidents, if the person has been arrested immediately after the incidents, the person should not be allowed to go to the bathroom, should not be allowed to go to the bathroom alone, because he can remove or he can destroy the important evidences from his body, from genitalia and all. Highest care should be taken by medical officers, because now this sentence in the bracket is very important. Innocence is very difficult to prove. As we have used the term, I will just show you. Rape is an allegation which is easily made. Any girl, any woman can easily say in the police station that this person has raped me. But it is hard to prove. It will be very difficult to prove that she has been really raped, and more hard or harder to disprove. Means if all the things are against that man, it will be very difficult for that man, or who has been accused, who has been blamed to have performed the rape, that person will have very much difficulties to prove his innocence. So highest care should be taken by medical officer. If the lady, that girl or woman, is falsely blaming any person, it will be very difficult for medical officer to prove that this person is innocent and he has not performed any such sexual crime or rape. That's why careful examination should be done. So injuries, we should carefully see for the injuries, also for the clothings, like missing buttons, foreign hair, fabrics, means his shirt might have been torn, maybe because of the struggle or resistance offered by the girl or offered by the victim. There can be violent struggle between them, so there can be missing buttons from his shirt, because she might have tried to pull that shirt or tear that shirt or cause scratches and try to injure that person. So you should see carefully for the injuries, scratches on his face, on his chest, on his back, missing buttons of his shirt, foreign hair. There can be exchange of the hair, in the pubic hair particularly, and fabrics. Then carefully see for the blood and semen stains. Blood stains can also be from the victim, so they should be examined properly and should be sent for blood grouping. There can be bites, bruises, scratches on the face and hands, and you should carefully see for the age of the injury. There can be bites, there can be bruises and scratches on the face and and on the hands or on the shoulder, they should be seen carefully for their age particularly, because the time the girl or the victim is telling and the age of the injury, that should match. Then smegma, I have already told you about the smegma. It is asked as a 2-mark question. What is smegma? So smegma is a thick cheesy secretion with bad odor, disagreeable odor, uh, and it is, just I told you, it is accumulated on the surface of the glands that is covered with the prepuce, and this smegma disappears during course because of the friction, between the vagina and penis. This smegma disappears during the intercourse and it reappears within 24 hours. Within next 24 hours it will again reappear. So that will also very important. If the smegma is absent, it is suggestive of the person has recently performed the sexual intercourse. Then vaginal epithelial cells can be detected on the surface. For this you will have to go for certain staining. So you will have to take the smear, you will have to take the specimen from the, or swab from the glands, and it is to be seen under a microscope. For with proper staining, vaginal epithelial cells can be detected. They will be suggestive of the person has recently undergone sexual intercourse. So this is all about rape. Rape is asked as a 10-mark question. It is asked as a question number 4, 10-mark question, very commonly asked. So we have seen all the details of rape. So importantly, you will have to write medico-legal importance, MLA, medico-legal aspect of rape, and that has been mentioned in each and every word of definition. Then another important thing is examination of a victim. Medical examination of a victim, what the things they are to be seen carefully, and examination of accused, all these things are to be mentioned. Now we will go to next type of sexual violence, or another type of this thing after rape, that is sexual offenses. So first is rape. Again I tell you in short about the two types of sexual offenses. Natural, where the natural sexual intercourse is performed, where the vagina is penetrated by penis, that is natural sexual procedure. So when the natural sex has occurred, it is called as natural sexual offenses like rape, incest and adultery. And unnatural means other than this exchange, or other than this contact between penis and vagina, any other route of sexual intercourse is called as unnatural sexual offenses. So they are sodomy, that is the anal intercourse, the buccal coitus, tribadism and bestiality. So now we'll see another 2-mark question, that is incest. So we'll see what is incest. So incest is sexual intercourse by man, sexual intercourse by a man with a woman within a certain degree of blood relationship. So the person has performed a rape with either his mother, daughter, sister or granddaughter. So if it has been done in very close relation or a certain degree of blood relationship, that type of sexual offense is called as incest. In India, it is not a cognizable offense and police cannot take notice of it unless it has been brought under 376 and 497 IPC. If that girl or woman complains about such a blood relative, then only the police can take action under 376 and 497 IPC. Otherwise, it is not a cognizable offense. And the cause of such a type of incest or such a type of crime is lust, brutality, abnormality of mind. Means that person might have some sexual perversions or might have some psychiatric disease, because of which he has performed such a crime, that is the sexual intercourse with the person with some degree of blood relationship. So that is, you can just write in 2 lines about the incest, short topic. Another topic is virginity. I will not teach you virginity because last year only this Indian government or Modi government has passed one important statement in the parliament, that virginity test should not be done. You know what is virginity? Virginity means, or the virgin is the woman who has never had undergone sexual intercourse. The woman or girl, also called as Virgo intacta, the woman who has never experienced or had never undergone any sexual intercourse is called as virgin. And there are certain signs of virginity are there. I will not teach you this topic because the government has clearly mentioned that all the tests for checking for virginity, whether the girl or woman is really virgin or not, all these tests for virginity have been banned. Legally you cannot perform any test for virginity, and also it has been removed from our syllabus also. It has been removed from all the syllabuses of MBBS, BMS, BHMS, all the medical courses. It has been removed from the syllabus. That's why I will not teach you, we will not discuss anything about virginity. It is medico-legally or legally it has been removed from the syllabus, and legally it is a crime to ask any girl to go for the test for virginity. So we will just omit this topic. Now we will go to the next very important topic, that is abortion. Abortion, again abortion is very common, very repeatedly asked 10 mark question. In question number 4 it is commonly asked as a 10 mark question. So abortion, you might have heard this term so many times. So what is abortion? It is expulsion of products of conception at any period of gestation before full term, before the completion of full term, that is 9 months, when the products of conception are expelled from the uterus. The procedure is called as abortion. Abortion, miscarriage, premature labor, these terms are not recognized in law and all are referred to as abortion, but sometimes these terms are used to signify the expulsion of embryo or fetus during first, second and third trimester of pregnancy. Means if it has been done, if the expulsion of the uterine contents has been performed in first trimester, during the first 3 months of the pregnancy, it is called as abortion. If it has occurred in second trimester, that is 4 to 6 months of pregnancy, the condition is called as miscarriage. And if it has occurred in third trimester, during 7th, 8th or 9th month of pregnancy, before the completion of the full period of pregnancy, that is in third trimester, it is called as premature labor. Otherwise in law all these things are same: abortion, miscarriage and premature labor, but they can be called as abortion if it has occurred in first trimester, miscarriage if it has occurred in second trimester, and premature labor if it has occurred in third trimester of pregnancy. Now there are two types of abortions: natural or accidental. Natural or accidental. Natural or also called as spontaneous. Natural or spontaneous or accidental. So these are the two types of abortion are there. So we'll see in detail about MTP Act. MTP Act is, I tell you, very commonly asked as 5 mark short note. It is very common in question number 2 where all the short notes of forensic medicine are asked. So in this question number 2 short note question, this MTP Act 1971 is asked many times. Till date it has been asked, I think in each and every exam there is going one question on or a short note on MTP Act. So MTP, what is MTP? Medical Termination of Pregnancy. So Medical Termination of Pregnancy Act explains that in which cases the abortion can be done legally. So what are the conditions, what are the different medical conditions in which a pregnant lady can undergo termination of the pregnancy. So under the Medical Termination of Pregnancy Act 1971, abortion has been legalized. So legally abortion can be done without any problem under on the 4 grounds, or there are 4 different conditions or grounds on which the MTP Act will allow that lady to undergo abortion, that is medical termination of pregnancy. So abortion, we also call it as MTP. In short, another term for abortion is MTP, that is medical termination of pregnancy. So we'll see one by one what are the different circumstances or different grounds on which MTP or abortion can be done legally. So first is therapeutic ground. Therapeutic ground means as a part of treatment. The condition where the continuation of the pregnancy will cause risk to the life of the pregnant woman. So there can be such conditions or medical conditions in which if the lady continues with the pregnancy, it can cause danger to her life. So conditions where continuation of the pregnancy will involve the risk to the life of pregnant woman or grave injury to the physical or mental health. If she continues with the pregnancy, it will cause damage to her health, or even the death of the pregnant lady can occur. So what we will have to do in this case, we will have to terminate the pregnancy. So medical termination of the pregnancy can be done according to this therapeutic ground. So it is to be done as a treatment to save the life of the pregnant woman. So indications. So what are the indications for abortion in under these therapeutic grounds? If the pregnant lady is having heart disease, organic heart disease, active tuberculosis, or severe uncontrolled diabetes, if she continues with the pregnancy, it can cause life threatening complications, and or even she can die if she continues with the pregnancy. So here if the lady is suffering from any organic heart disease, tuberculosis, or severe uncontrolled diabetes, you will have to go for termination of the pregnancy. Then hypertension with cardiac or renal complications. If the lady is having severe hypertension where she has developed the cardiac complications or the renal complications because of long standing hypertension, the continuation of the pregnancy is not possible, you will have to go for MTP. Then nephrotic syndrome, right? Again a renal disease, nephrotic syndrome, where there is a high proteinuria and all. You might have studied it in systemic pathology. Nephrotic syndrome cannot continue with the pregnancy. Then hepatocellular failure means some liver damage or active hepatitis or pancreatitis cannot continue with the pregnancy. Then toxemias of pregnancy, that you will study it in detail in third year in obstetrics. Toxemias of pregnancy called as preeclampsia and eclampsia, because continuation of the pregnancy can cause convulsions and even the death of the pregnant lady cannot continue with the pregnancy. Hydatidiform mole, again this thing you will study in obstetrics third year. Hydatidiform mole, where the fetus has not developed properly and it has developed only in the form of grapes, just like looking like the grapes of bunch of the grapes that will be seen on the ultrasonography. And if the sonography reveals that the baby is not developed and the product of conception is only in the form of some grape like clusters or grape like outgrowths and not a living baby as such, the continuation of such a pregnancy will cause severe life threatening complications to the pregnant lady and it should be terminated. Uterine hemorrhage during pregnancy, if she gets some hemorrhage, if she gets some pervaginal bleeding, under such conditions the pregnancy needs to be terminated. And also infections, if she has got any intrauterine infection or any genital tract infection which can be dangerous to her life as well as to the life of the baby, such pregnancy should be terminated. Then malignant neoplasms of breast or genital tract, if she is having any cancerous growth, if a pregnant lady is detected to have some cancerous growth in breast, she is having cancer of the breast or anywhere in the genital tract, such pregnancy should be terminated. Then repeated cesareans, if the lady has previously undergone repeated cesareans and continuation of the pregnancy can cause damage to the uterus and even the perforation of the uterus, where it can cause peritonitis and death of the woman. So in such circumstances the pregnancy should be terminated. Then irreducible prolapse of gravid uterus, if the uterus undergoes prolapse, again this can cause life threatening complications and should be terminated. Threat and insanity, if she is having some serious mental illness. Then second, you got, so in these cases or under these circumstances which have been grouped under therapeutic grounds, if the pregnancy is continued, it will cause life threatening complications to the mother. She can die because of such complications because of continuation of the pregnancy, and under certain circumstances the pregnancy should be terminated to save the life of the pregnant woman. So these all are as a treatment part where the abortion should be performed. Now second group of causes is eugenic ground. Eugenic ground condition where there is a substantial risk that the child is likely to have physical or mental anomalies. So means maybe during the third or fourth month, if the lady has undergone ultrasonography and it has been detected that baby is having severe physical anomalies, or physical anomalies have been detected on ultrasonography or other investigations, it can happen that you after the birth of such a baby, it will be very difficult for the family to take care of such a baby, or it will be very difficult for that baby to survive after the birth. In these cases you can go for the decision like MTP. So on eugenic grounds, the conditions where there is substantial risk or high risk that the child is likely to have physical or mental anomalies after as to be seriously handicapped. म्हणजे असं होऊ शकतं की जन्मानंतर ते बाळ खूप त्याला हँडिकॅप असं अपंगत्व असेल, विच विल बी व्हेरी डिफिकल्ट फॉर दॅट बेबी टू कंटिन्यू ड्युरिंग इट्स लाईफ टाईम. सो लेंथ ऑफ प्रेग्नन्सी शुड नॉट बी मोर दॅन 20 वीक्स. ह्या कंडिशनमध्ये युजेनिक ग्राउंड्समध्ये द लेंथ ऑफ द प्रेग्नन्सी शुड नॉट बी मोर दॅन 20 वीक्स. इफ द लेडी हॅज गॉट जर्मन मिझल्स, स्मॉल पॉक्स, चिकन पॉक्स, व्हायरल हेपॅटायटिस or any other serious viral infection, you might have heard of torch. Torch is TO is toxoplasma, R is cytomegalovirus, C is R is rubella, C is cytomegalovirus, and H is herpes. So if the lady is having some such type of viral infection like German measles, smallpox, chickenpox, viral hepatitis, or any other viral infection like herpes, toxoplasma, or cytomegalovirus infection, what will happen because of the action or the bad effects of such a viral infection? The baby is likely to have some serious handicap that may be physical or mental. There can be abnormalities in so many organs, in the development of so many organs or so many parts of the body, and also the severe mental retardation and all these physical as well as mental abnormalities are likely to be there in a newborn baby, and that will affect that baby for long term. That's why such a pregnancy should be terminated. If any pregnant lady is found to have such a viral infection, the pregnancy should not be continued. Again, the limit is the pregnancy should not be more than 20 weeks. Then exposure to x-rays and other radiation. If the lady has undergone repeated x-rays for some other illness or for investigation, she has undergone x-ray, CT scan, MRI, or she is having history of such type of exposure to the radiation, the pregnancy cannot be continued because the radiation is likely to affect, as we have seen in toxicology, bad effects of radiation on pregnancy. It is likely to cause dangerous effects on the fetus. That's why such a pregnancy cannot be continued. If the lady has received cytotoxic drugs, or as a treatment of cytotoxic drugs are used mainly in the treatment of cancer. If the lady has received, the pregnant lady has received such a cytotoxic treatment, the pregnancy should be terminated. Then parents with inheritable mental condition or chromosomal abnormality. If the parents दोघांपैकी एकाला, if the parents are having such a inheritable mental condition or chromosomal abnormality, the child is likely to have such a mental condition, or because of that chromosomal abnormality there will be so many anomalies will be present in the baby. In such parents with such a history, the pregnancy should be terminated. Now third important is humanitarian grounds. Humanitarian grounds, if the pregnancy has been caused by rape, if the that girl or woman has undergone rape, she has been raped, and as a result of rape she has got pregnancy. According to WHO, health is not merely absence of disease but a positive state of overall physical, mental and social well-being. म्हणजे फक्त आजार नाही म्हणजे आपण हेल्दी आहोत असं नाही. सो देर हॅज टू बी ओव्हरऑल फिजिकल, मेंटल अँड सोशल वेलबिंग इज व्हेरी इम्पॉर्टंट. द प्रेग्नन्सी कॉज बाय रेप कॅन कॉज grave injury to her mental health. So if on humanitarian ground, if the pregnancy has been caused by rape, by the law it can be terminated without any legal obstacles. So pregnancy caused by rape can cause severe injury to her mental health. It can be terminated. Then fourth is social grounds. Social ground, the pregnancy in a married woman due to failure of contraceptives. Again, it is very common if any say married couple, if she undergoes pregnancy and she comes to know that she is pregnant, maybe by urine examination, or what we call it as urinary pregnancy test, or by ultrasonography, she comes to know that she is pregnant, but she doesn't want the issue, maybe because of her some social things, or because of her business or service and all. She doesn't want the pregnancy right now, but because of failure of contraception, she has undergone pregnancy, she can terminate it. On the social grounds, pregnancy in a married woman can be terminated under this heading, under this point, if the pregnancy is because of failure of contraceptive, or environment of pregnant woman during continuation of pregnancy and at the time of childbirth can cause injury to her health. म्हणजे दॅट मे बी बिकॉज ऑफ सम, म्हणजे घरात काय अडचणी असतील, घर छोटं आहे, घरात खूप लोक आहेत, किंवा फायनान्शियल प्रॉब्लेम्स, या सगळ्या गोष्टींमुळे कंटिन्युएशन ऑफ द प्रेग्नन्सी ऑर न्यू अरायवल मे कॉज फायनान्शियल बर्डन, अँड दॅट्स वाय द कपल वुड नॉट लाईक टू हॅव न्यू बेबी इन देअर होम. That's why in such cases pregnancy can be terminated. So environment of pregnant woman during continuation of pregnancy and at the time of childbirth would cause injury to her health, so she can ask for termination of the pregnancy. Then environmental conditions like heart disease with no one to help her in domestic work. म्हणजे असं होऊ शकतं, त्या प्रेग्नंट लेडीला काहीतरी आजार आहे, आय हॅव जस्ट मेन्शन हिअर हार्ट डिसीज, पण अजून दुसरा असा काहीतरी आजार आहे की ज्याच्यामुळे तिला प्रेग्नन्सीमध्ये कामं करता येणार नाहीत, आणि घरामध्ये तर ती एकटीच आहे, तिला मदत करायला घरामध्ये कोणी नाही आहे. So in this condition also she can ask for medical termination of the pregnancy. And one thing just I told you, new arrival may cause financial burden. आधी 2-3 मुलं आहेत घरामध्ये आणि आता परत प्रेग्नन्सी झाली, तर शी कॅन, तर नवीन अरायवलमुळे परत खर्च वाढणार, त्याचं सगळंच खाणं पिणं शाळा सगळाच खर्च, अजून एका नवीन मेंबरमुळे सगळेच फायनान्शियल कंडिशन क्रायसिस होऊन जायचं सगळा. दॅट्स वाय न्यू अरायवल मे कॉज द फायनान्शियल बर्डन अँड द कपल कॅन आस्क फॉर मेडिकल टर्मिनेशन ऑफ द प्रेग्नन्सी. देन स्मॉल हाऊस विथ ऑलरेडी 2 चिल्ड्रन, जस्ट आय टोल्ड यू, आधीच घरामध्ये 2 मुलं आहेत आणि अजून एक नवीन येणार म्हटल्यावर त्यांची आर्थिक परिस्थिती बिघडणार, घर छोटं आणि सगळ्याच अडचणी. आस्क फॉर medical termination. These all are the social grounds. And already subnormal child, म्हणजे घरामध्ये आधीच एखादं सबनॉर्मल, दॅट मे बी फिजिकल हँडिकॅप ऑर सम मेंटल इलनेस, म्हणजे आधीच घरामध्ये एखादं सबनॉर्मल चाइल्ड आहे की ज्याच्याकडे तुम्हाला खूप जास्त लक्ष द्यायला लागते, आणि अशा कंडिशनमध्ये अजून एखादं नवीन बाळ येणार असेल तर दॅट विल कॉज द ओव्हरलोड ऑन द कपल. दॅट्स वाय in such cases you can go for termination of the pregnancy. So I'll just revise all these grounds for MTP. First is therapeutic ground, when the condition of the pregnancy would involve the risk to the life of the pregnant woman or can cause grave injury to her physical or mental health. When the condition of the pregnancy can cause life-threatening complications in the pregnant woman, you can go for termination of the pregnancy as a therapeutic measure. Then eugenic ground, conditions where there is substantial risk that the child is likely to have some physical or mental anomaly, if she has got some viral infection, or she has got exposure to radiation, or she has received some cytotoxic drugs. Then humanitarian ground, if the pregnancy has been caused by rape. And on social grounds, on social ground, if she is already having so many problems in the family because of failure of the contraception, or already having 2 children at home, or already having some subnormal child in the home, whose care is to be, or highest care is to be taken of such a mentally or physically handicapped child, and one more child will add another burden or another workload on the family, or as well as financial burden on the family. In such cases, on social grounds, you can ask for termination of the pregnancy. Now what are the I will just finish with this. What are the requirements for termination of the pregnancy according to MTP Act? So MTP Act has given the grounds for terminating the pregnancy, as well as how the termination should be done. So requirements for termination of pregnancy म्हणजे तुम्ही कधी पाहिलं असेल सरकार मान्य गर्भपात केंद्र असं दवाखान्यांवर बोर्ड लावलेला असतो. सरकार मान्य गर्भपात केंद्र याचा अर्थ तुम्ही कुठल्याही दवाखान्यामध्ये कुठेही जाऊन MTP करू शकत नाही. MTP करण्यासाठी तुम्हाला एक प्रकारचं दवाखान्याला एक प्रकारचं लायसन्स लागतं गव्हर्नमेंटचं. अँड द डॉक्टर ऑर दॅट हॉस्पिटल विच हॅज रिसिव्ड सच license that only can perform the abortion or medical termination of pregnancy. So MTP Act has also given the rules and regulations for conducting the MTP. So first is under emergency. In emergency, any register, if it is a life-threatening complication or it can cause death of the pregnant woman by continuation of the pregnancy, and it is very emergency or it is very needed that she should urgently undergo termination of the pregnancy, any registered medical practitioner, any legal doctor, irrespective of his experience or training in obstetrics and gynecology, can terminate the pregnancy at any place irrespective of its duration, if he is of the opinion formed in the good faith that the termination of such pregnancy is immediately necessary to save the life of the pregnant woman. म्हणजे प्रेग्नन्सी कंटिन्युएशन झाल्यामुळे जर तिच्या आयुष्याला तिच्या जीविताला जर धोका होणार असेल तर एनी लीगल डॉक्टर, एनी रजिस्टर्ड डॉक्टर, इरिस्पेक्टिव्ह ऑफ हिज एक्सपिरियन्स, म्हणजे त्याला ऑब्स्टेटिक गायनेकमध्ये काहीही अनुभव नसला, कॅन टर्मिनेट द प्रेग्नन्सी ॲट एनी प्लेस, म्हणजे तिथं रजिस्ट्रेशन नसलं, त्याला लिगली परवानगी नसली तर अशा कुठल्याही ठिकाणी तो टर्मिनेशन ऑफ प्रेग्नन्सी करू शकतो. पण इफ इट इज नॉट ॲन इमर्जन्सी, if it is not an emergency where the duration of the pregnancy is not more than 12 weeks, MTP can be done on the opinion of one registered practitioner. Where the duration of the pregnancy is more than 12 weeks but less than 20 weeks, opinion from other doctor is necessary. म्हणजे तुम्हाला दुसऱ्या एका स्पेशलिस्ट डॉक्टरकडून सल्ला घ्यायला लागेल. इफ द ड्युरेशन ऑफ द प्रेग्नन्सी इज मोर दॅन 12 weeks, दॅट इज 3 महिन्यापेक्षा जास्त असेल, तर यू शुड गेट द सेकंड ओपिनियन फ्रॉम द डॉक्टर. And the opinion should be given in good faith. The registered medical practitioner should have specific experience in gynec and obs, and he should be registered with certifying board for this purpose. Just I told you, सरकार मान्य गर्भपात केंद्र असे त्या दवाखान्याला परवानगी असेल आणि त्या डॉक्टरांना असं ॲबॉर्शन करण्याची परवानगी असेल लिगली, आणि त्यांना व्यवस्थित ऑब्स गायनेकमध्ये काम केल्याचा अनुभव असेल, and if that doctor is certified accordingly, then only that doctor only will be able to perform the termination of pregnancy. So registered medical practitioner should have specific experience in gynec and obs, and he should be registered with certifying board for this purpose. And MTP must be carried out in a government hospital or a place approved by government. What I told you, sarkar manya garbhapat kendra, only in such a legal place or which has been legally allowed to perform such termination of pregnancy, only at such places termination of pregnancy can be done, and there has to be consent from the woman. In case of lunatic or minor म्हणजे 18 वर्षाखालील असेल किंवा lunatic म्हणजे काही mental illness असेल, the consent should be taken from the guardian. So this is all about termination of the pregnancy. So when the MTP Act is asked as a 5-mark short note, you will have to mention all these 4 grounds: therapeutic ground, eugenic ground, humanitarian ground, and social ground. And also you will have to mention who and where, who can perform the MTP and where the MTP can be performed. In emergency there is no any rule, but in planned MTP you will have to follow certain rules and regulations to conduct the safe termination of pregnancy. So okay, we'll stop here today. Thank you.